Alzheimer's and dementia, diseases that used to target the elderly, are now taking hold of a different age group.
One of the things I've noticed in the last 5 years or so is that many more patients that are younger are coming up to the clinic. Younger than 65. It used to be the patient age 80, 75, 85 that will be coming to the clinic.
Kingston is an aging city with a new municipally funded report estimating that 44% of our population will be over the age of 55 in the next decade. Canada's healthcare system estimates that 8% of the aging population is currently diagnosed with a dementia-based disease. For the Kingston region, that equates to just over 4,300 residents in our area that will be diagnosed in the next 10 years. According to Queen's professor Angela Garcia, that number is expected to skyrocket, and the system isn't prepared.
The governments are preparing. However, they are preparing very slowly. And there is no question that it's going to be an impact. There is going to be an impact on the economics of health care, because we know that even doubling the number of patients of Alzheimer's disease or dementia within the next 30 years or so, the cost of that will be 10 times higher than what it is today.
And American-based businesses are taking notice, with an Alzheimer's and dementia home in the planning stages in Kingston's West End.
Bringing a specialized Alzheimer care center to Kingston, and that would be a 66-bed community licensed as a retirement home that would be constructed specifically for those with Alzheimer's and other forms of dementias.
JEA is expanding here because the limestone city meets its business requirements when it comes to an aging population, the income of area seniors, and land availability and price. The private sector company sees an opportunity to make money where the public sector is falling short. Something this doctor finds concerning.
Because the private sector is there to make money on terms of the healthcare. And the people with this disease, they are unfortunate enough not to have to pay on top of that.
Now that a municipal seniors report has been completed, a need for more age-friendly services in the greater Kingston area is evident.
The needs of the boomers as they age are very different than today's current seniors, both in terms of how they communicate, what kind of information they want, what kinds of services they want. So we're trying to be strategic and plan ahead. We need to try and get ahead of the curve, although we're kind of at the curve.
We had hoped that society would have been ready for seniors by the time baby boomers became retirement age, but we're finding that we're not ready for the crunch that's going to hit in the next few years.
As the city and the country address a changing need for seniors and a disease that is expected to double its number of victims in the next 30 years, the answers we don't have become problematic.
We know very little about the brain. We know much more now than 10 years ago, tremendous amounts more. Still, we know so little.
Stephanie Wilkins, CKWS News Watch, Kingston.